Joining us now is Dr. Lee Norman, who is Secretary of the Kansas State Health Department. Mr. Secretary, Dr. Norman, thank you so much for your time this evening. I know you are very busy and right in the middle of it. Thanks for being here.
Thank you, Rachel. Appreciate being here.
I was struck by not just your blunt language about what the public in Kansas needs to do. Whatever's happening with the legislator, what's happening with this political fight, as you described it, the public needs to stay home so we can beat this scourge. I know you've been blunt spoken throughout this crisis, but I'm also struck by the fact that you're expressing anger here. I am so angry, you said, shame with an exclamation point. Tell me about what is animating you on this. You do seem like this is something that has really got to you.
Well, I'm a very moderately tempered individual normally, but this one was a mistake. I have nothing against religious gatherings now. I have it against all gatherings now. And I just don't think that a religious gathering should be singled out. We're not limiting people's ability to worship. You pointed that out in the earlier segment, that there's all sorts of novel and interesting creative ways. And I think most church and church leaders are actually doing that. But to reverse it, for the people to stand down and feel the need to, especially coming into Easter weekend, I think it's just a big mistake. It's very political, I think.
One of the things that I was struck by in reading about this controversy in your state and this political sort of confrontation now is how you in your office and the authorities in Kansas have been tracking clusters within the state. You have been trying to map individual clusters of the virus and where people got it and how it was transmitted. It seems from the public reporting on this that you have been able to track some of the spread of the virus in Kansas to religious gatherings of different kinds.
Yes, that's true. There's been 4 gatherings that have been quite specifically related to church events or services. There's been 3 deaths that have related to that. One was a woman who went back to her home county, infected her husband, and they both died. And we don't even know all of the people that they might have contacted because they died. So it's a whole cluster of them. We know that the 4 of them had between 10 and 40 people that have become infected because of that. And it's just a bad idea for that kind of a gathering. And it's unfortunate coming into Easter weekend, and it's not really about religious freedom. It's really about not gathering in such a manner.
What are your projections for your state? How well equipped do you feel like your state is, given what you think is going to happen in terms of the trajectory of the epidemic and the measures that Kansans are taking or not to prevent continued spread of it?
We've been watching this, of course, Rachel, because it hit the coast before it came to the heartland. So we've been able to stand up, organize our medical care facilities, our public health departments in the 105 counties. I think that we are going to be in pretty good shape this round. Well, there's a couple of things we don't know. One is is it going to be seasonal or not? Is it going to go away in the late spring, summertime, and is it going to come back in the fall? I was deployed in the Middle East in 2017, 2018, so I saw firsthand the Middle East respiratory syndrome, which was a coronavirus. It didn't hit till the peak until the 4th year, and it's still 7 years later grinding along. Will this one act that way? We just don't know this particular virus well enough to answer that question yet.